What is herpes? A variety of diseases caused by viruses in the Herpesveridae family fall under the name herpes. Different types affect both animals and humans. In humans, Herpesveridae cause oral and genital herpes, chickenpox and shingles, cytomegalovirus, infectious mononucleosis, and Kaposi's sarcoma and other cancers. 8 viruses in this family can cause disease in humans, and all produce lifelong infections, though they may produce symptoms only sporadically or be asymptomatic. Herpes simplex virus, HSV-I and II are responsible for oral and genital infections, with HSV-I more likely to cause orofacial symptoms and HSV-II more likely to cause genital symptoms. Both viruses infect the nervous system. If symptomatic, they produce small painful blisters on the affected area that become scabs as they heal. Both types are transmitted through skin-to-skin contact with an infected person. Varicella-zoster virus, VZV, causes chickenpox and shingles, and it is also called herpes zoster. Chickenpox begins as a rash, which is followed by the formation of small, itchy blisters on the body and scalp. It is contagious and remains in the nervous system for life, though it rarely has serious complications. VZV infection is typically more serious in adults than in children, and it may progress to shingles, which is characterized by headache, malaise, fever, and pain, in addition to blisters. In severe cases, the patient may develop postherpetic neuralgia, characterized by long-lasting, severe pain that is often difficult to manage. Epstein-Barr virus, EBV, is extremely common, but usually asymptomatic. It most often causes infectious mononucleosis, mono, which presents as sore throat, fever, and fatigue. Infectious mononucleosis is spread via saliva and is self-limiting, meaning it can usually be resolved without treatment. Rare and potentially fatal complications occur in 5% of all cases. EBV and Kaposi's sarcoma-associated herpes virus, KSHV, which causes Kaposi's sarcoma and other tumors, both affect the immune system and remain in the B cells while latent. Cytomegalovirus, CMV, causes symptoms similar to infectious mononucleosis, and is spread through bodily fluids. It is treated with an immunoglobulin injection, sometimes in combination with an antiviral. Roxella-virus, also spread through bodily fluids, is the cause of the childhood disease Varicella, characterized by rash, high fever, respiratory symptoms, irritability, and decreased appetite. Roxella usually resolves on its own. Both CMV and Roxella virus reside in the T cells of the immune system when latent, and both can be life-threatening in infants and patients with compromised immune systems. Signs and symptoms. HR: a viral infection that causes sores or blisters. It is food and transmitted through THXH and GFBDL fluids and DNTH via ER. THR are 2 types: FHR, herpes MLX1 and DHR MLX2. THMTM of HR and Viridae and DNG and the Viruti, WLL by gender. TH herpes MLX1 virutens TB the MRWDRDF the 2 viruti and is typically responsible for facial HR infections. Cold sores, also RFRRDTS fever blisters, RUULLTHMT common MTMF a facial HRNFTN. The RRWLLN, RDBLTRTHTGNRLLR on TH lips RTH at R skin FTHMUT. The BLTRTNDT BERTND líkelú fluid BFR Dr. NGUNDHLNG usually within TWT/THRWK. OthRMTM of facial HR and Ludar throat, FVR, WLLNGLND, or an RNTHMUT. Genital herpes is a sexually transmitted disease that is most often caused by the herpes simplex 2 virus. In rarer cases, genital herpes can be caused by herpes simplex 1. Herpes symptoms can manifest as red blisters or sores on or around the genitals, which dry up and heal in the same manner as oral cold sores. Genital herpes can affect any areas of the genitalia, including the vagina, labia, penis, or scrotum, However, it can also affect surrounding areas, especially the anus, buttocks, and upper thighs. Some people do not show any major symptoms of herpes. They may have slight patches of red skin around the genitals or very small sores that resemble ingrown hairs or pimples. People with herpes around the buttocks or anus may notice bumps or pain that they may mistake for hemorrhoids. Herpes sores inside the urethra can result in difficulty or pain while urinating. Women with genital herpes may notice increased vaginal itching. Since herpes is a virus, there is no cure, therefore, the symptoms of herpes may heal and then reappear over time. The reappearance of herpes, referred to as outbreaks, tend to have milder symptoms because the sufferer's immune system becomes used to the virus. Sores and blisters tend to be the most noticeable symptoms of herpes of both the facial and genital varieties. Other symptoms that may continually occur are fever, headache, sensitivity to light, swollen glands, or sore throat. Some cases of herpes outbreaks are extremely mild and show few visible symptoms. Some people with the virus experience physical sensations, referred to as prodrome, that can serve as a forewarning of an outbreak. Prodrome symptoms include tingling in the previously affected areas, leg pain, and back pain. How herpes is caused. Herpesveridae, HSV-I herpes. HRRTW main forms HSV-I, HSV-I HSV-II. HSV-I TLL causes herpes F the M-ut, L not WN as LDR, WHL HSV-II meters are commonly UHR of THG and TL. This virus is D from an NFTD person TN on NFTD or NTHR MLLBRK and THK and RV mucus. Both forms of TH virus are contracted and the M manner, TH-WHH type FV-RU1 comes and NTTWTH determines WHHRTF-THBD as FFTD. HSV-I-HRF the mouth, also not WNLDR. It is TLL contracted through K and GR sharing TM THTM and NTTWTH ut, UH, Dr. NK, tooth brew HR eating out NL. HSV-I-HBN known to you herpes of the GNTL, TH is anti-common. HSV-I-TLL-UFWR outbreaks then HSV-II. HSV-II UHRF the genitals and D is THMT life altering of TH herpes MLXV-RU. It is DTHRULNTT between BTHTRGHT and DHMSHULULND can affect BTHTHGNTL and RTUM. ITU outbreaks FBLTR that BRT into RND can be mild TXTRML and full CNTRRTLRBLF, THUHVNTRTD THV-RU that UHRFTH genitals and still pass it NTTHRRDNR. Even if TH are not experiencing an outbreak. THHNMNN occurs THRHDDNG. PRT of TH virus THTUHRT and THUDR lay ref skin, WHH can TRNFRT and THR person during sexual NTTWHN THKN sheds FF. THV-RU THT causes herpes remains in the RNBDFR-THRT-FHR-HRLF. Despite this, TNNLLV4AVR-HRT-TM outside F the human BD. THR-FR it is an RLMBLT contract HSV-FRM bathrooms are THR-able. It is also important to note THT HSV and TRNFR FRM1 RNT another through VN microscopic TRN the skin. WHTHR HSV1R HSV2 causes a FHR, NTRTNG the steak and room north NTLL TRA or in life and DHLTH. THR-FR, TMRTNT to refrain FRMHRNG any utensils that touch the M-ut of NTHRRN, even if they are family or friends, and D to LWURTTN during sexual NTRR, HRFFTHRNDFFRNTL, NDMLGTHRNTRLVWTH ut not widths NG they HVNTRTD the viru, though THRTLL perfectly BLFNGTNTNTHRRNWH may and THVUH luck. How herpes is treated. Herpes a viral infection that is spread FRMRNT, RNB direct HL contact. WHLTHRRMRTHN70 viruses NTH herpes family, only 4 affect human, VRLLZTR, VZV, the HKN poxviru, RHNGL, ಝಾrсomplex, HSV, ETNBRR, EBV, and sutomegalovirus, CMV. Of TH most MNL anti-RTD readily diagnosed as the HRMLX viru. WHLTHRZNT cure. There are several herpes TRTMNTVLBL that can help reduce TH severity and frequency of outbreaks. HSV THRTIRT2, HSV-1 and HSV-II, RTVL. Type I is HRTRZD by THRNF fever blisters RNG upon THL, RNTMUT-ND, sometimes, RNTLD. T2UTDFFRNTNT produces flu DFLLDLRNGNTL HWVR, TMNMNTN that herpes BLTRRMNLTDTTHRWHN, NFT, THM appear anywhere and THBD, VNTHFNGR. FRTHRN, DGNFHR is MD and TD by blood TTFRTH presence of RTN NTBD and DLTOR flu D. The LTT development N herpes TRTMNTNVLV the UFR, XTNGVN, UHTH polio NDMLLXVN. Unfortunately L, THR good ND bad NW in this DRTMNT. FRT, trial TUD NDTTHTTH vaccines MRVNT the DVLMNT of HRNML, but UULLDNTHNG2RVNT Utbricane THWH already HVTH virus. HWVR, a TNTL HRVNLLDINLX, IRNN. Vaccine MRVNTBTH primary NFTNNDR RNG Utbricane. WHLITZRNTLBNG used NMRTHN50 it not XTD to be approved and THU. S. FR several MRR, FETLL. Author HRTRTMNT include NTVRL drug, such LVR, VLLVR, NDFMLVR, EHMDTNMTBLZDABTDFFRNTL. But the amend GLBTWNTHM to NHBTVRLRLTNF the HRV unhealthy cells. However, TH medications are RMRLGNTL herpes TRTMNT, LTH ukfamciclovir LBNFLFRTRTNGHR-zoster. In DDTN, these drug M produce DFFT in a small RNTGFL, UHNU, DZZN, vision deterben, FVR, JNTN, and yellowing of the RKN. SNTHNDTNNVLVMRMDMUNT, VRL NutriTNLULMNTRNW recognized as FFTVHRTRTMNT. On of THBT to DDTRNDRTNTHMNTRNG of TH ratio FTHMN acids, LLN, and RGNN. Numerous studies HWTNRDLVLFLLNBLKTHNTHFRGNN proteins, WHHRNDDFRVRLRLTN. TH idea is to LMTRGNNRHFD, chocolate, FH, GRN, ND nut, WHL increasing the consumption FLLNRHFD. Abundante natural FLLN and ludultre, BF, milk, cheese, GG, and beans. Visit the website. Click below.